Welcome to Know Your DNA's podcast, where we journey into the intricate landscape of DNA, health, and the innovations of at-home care. Every episode promises new discoveries, insights, and the science that impacts our daily lives. I'm Alex, and I'm thrilled to guide you through today's exploration. Let's get started. Welcome back to Know Your DNA's podcast, where today we delve into the complex interaction between our DNA and health. With us today is expert Jordan, who will be sharing insights on the genetics of addiction. Hi, Jordan. Could you start by introducing us to the topic?
Hello, Alex, and thanks for having me. Certainly. We're talking about how addiction isn't solely a result of someone's choices, but it's also influenced by their genetic makeup. Specifically, we're looking at how having a family history of addiction may increase one's own risk, especially if the addiction is in first-degree relatives like parents or siblings.
I see. And does having a higher risk mean you're doomed to struggle with addiction, Jordan?
Not at all, Alex. While it is true that genetic factors can put you at a greater risk, they don't dictate your fate. Lifestyle choices, environmental circumstances, and overall health are significant factors that influence whether a person will develop addiction.
That's reassuring to hear. Now, there are genetic tests out there that claim to assess one's risk for addiction, correct?
Yes, while common commercial DNA tests assess a range of health risks, they often don't include addiction. Tests like AvertD by SolveD Health and the Genetic Addiction Risk Score, or GARS, are designed to recognize genetic patterns that may signify a higher risk for addiction.
Fascinating. And are these tests widely available like some of the other genetic tests we hear about?
Tests like AvertD are clinically validated and must be administered by a doctor. They're a bit more specialized in what they do, like evaluating the risk for opioid use disorder and providing results quickly, typically within 48 hours. GARS is a similar clinical prescription-only test that can evaluate an entire family's risk.
So how exactly does our DNA influence our risk for substance abuse disorders?
Researchers have been successful in identifying risk-related genetic variations. These variations particularly impact our reward pathways, which control how we respond to pleasure and gratification. It's the interplay of these genetic predispositions with environmental factors that can increase risk for addictive behaviors.
This might be a tough pill to swallow for some, knowing that a family member's struggles could potentially affect them genetically.
Absolutely. But it's crucial to underline that nobody inherits addiction genes per se. It's more about inheriting reward-seeking behaviors which could mutate into compulsive and addictive behaviors under certain conditions.
Can DNA testing provide a clear prediction for addiction then?
Well, not a prediction as such. Nevertheless, knowing you carry certain genetic markers can act as an early warning system. It helps you and your healthcare provider to make more informed decisions regarding your lifestyle and health management to prevent addiction.
Let's shift gears a little. What impact do nature and nurture have on addiction?
It's a balanced interplay, Alex. While our DNA can predispose us to certain reactions to addictive substances, our environment equally shapes how those predispositions play out. For instance, the intensity and nature of your brain's response to drugs, influenced by genetics, can determine your addictive tendencies.
And does our metabolism play a role too?
Definitely. How fast your body eliminates toxins can influence addiction risk. Those with faster metabolisms might not find the after effects of substance use as deterrents, increasing their risk for addiction relative to those with slower metabolisms who experience prolonged discomfort.
Before we wrap up, could you offer some advice to listeners who may have a genetic risk for addiction?
Of course. First, limit exposure to potential vices since availability and access increase the risk. Secondly, treat any comorbid conditions like depression or anxiety, as mental health is strongly linked to substance abuse risk. Managing stress effectively is also key in reducing the likelihood of developing an addiction. Lastly, it's vital to seek help if you find yourself struggling with substance use, regardless of whether you've had a DNA test.
Thank you, Jordan, for this insightful conversation. It truly demonstrates how understanding our DNA can help us make better lifestyle choices, especially when it comes to preventing addiction.
My pleasure, Alex, and to anyone listening, remember that support is always available, and reaching out for help is a crucial step towards recovery.
Absolutely. Thank you all for joining us on Know Your DNA's podcast today. Stay informed, stay healthy, and we'll catch you on the next episode. As we conclude another enlightening episode of Know Your DNA's podcast, I hope you're leaving with a renewed sense of wonder about the world within us. From the strands of our DNA to the choices we make for our health at home, it's all a journey of understanding. I'm Alex, thanking you for being with us today. Stay informed, stay inspired, and we'll connect again soon.